functions can be affected. Okay, but the thing, the keynote, the key, or the most important thing to remember is you can't tell how healthy your kidneys are by how you feel until it's too late, or until the process is advanced, way advanced, when you develop kidney failure. So in the early stages, you feel healthy. And the only way you can tell that a kidney is not healthy is by doing a blood test to measure a protein called a creatinine, and also by doing a urine test to measure um, a protein in the urine called albumin, or just a non-specific protein. So if anybody asks, or if you want to find out from your doctor how healthy your kidneys are, you need to ask them for a blood test for creatinine. You can ask, what is when we do the blood test for the creatinine, we use it to calculate what we call the GFR for short. So that is really what you want to remember. You ask your doctor, what is my GFR? And also, do I have protein in the urine? So the GFR number to have is as close to 100 as possible. Okay, so that means health, as close to 100. I don't want to see significant amounts of protein in the urine. The reason I say this is that there are more common problems that cause kidney disease than cancer. So the most common problem is diabetes, high blood sugar, and a close second is high blood pressure, hypertension. Those are the two top causes of kidney disease, and they're so common amongst all age groups, more importantly, the elderly, and also more common amongst African Americans and other ethnic groups. So it's important that everyone gets an annual checkup and gets screened for kidney disease. The way multiple myeloma affects the kidneys is because the overproduction of those myeloma proteins, those abnormal proteins, can filter through the kidneys and damage the kidneys. And then you have waste products build up in the body. Also, those proteins can leak into the urine, lots of it, and it can cause a type of disease called deposition disease, light chain deposition disease, where people swell up, have swelling of their ankles, their legs, around their eyes, and their hands. So that's one way it can also present. It can also, the calcium that leaks from the bones that are broken from myeloma can also affect the kidneys, can also damage the kidneys. But the most common way that myeloma affects the kidneys is by congealing within the tubules of the kidneys, causing what we call casts within the kidneys. And again, those things you may not notice because you may not feel sick until you develop kidney failure. So you can have mild or moderate forms of this problem without having kidney failure. It's only a blood test that can reveal that. Okay, so about 50% of people who have been diagnosed with myeloma over the course of the disease could develop kidney failure or kidney disease, some form of kidney disease, okay, not necessarily kidney failure. And there are ways to prevent, developing kidney disease or kidney failure, especially the most common one I just spoke about, cast nephropathy. Staying very well hydrated, drinking at least 2 or 3 liters of water, so 64 to 96 ounces of water every day. Avoiding some painkillers like Aleve, Motrin, ibuprofen. We take them commonly because they're very effective. They work better than Tylenol, but you have to know your health. You have to make sure, you get your doctor's okay before you get anything over the counter, okay? Because you may have some early stages of kidney disease and not know it. Your doctor may not give you that information because they don't want to create anxiety because it's a very mild form. But taking those medicines can lead to worsening kidney function, okay? The IV dye they use in doing some imaging studies, the ones that contain iodine can also affect the kidneys if you have myeloma. So there are a bunch of things, and like I said, some medications used to treat myeloma can affect the kidneys, or their doses need to be adjusted because your kidneys are not working at 100% to get rid of the breakdown products of those medicines. So these are all the things, you have to, an important partnership with your doctor is very important so that you can understand your own situation, not another person who has myeloma situation who says, oh, my doctor says it's okay to do this. You have to know your own health, partner with your doctor and determine ways to reduce the risk of developing kidney disease or kidney failure. So I'll take questions if you have any other